And let me give for you a sense of who you're going to hear from tonight. First, I'm going to give an overview of some numbers and general information. Second, we're going to be hearing from Shanae Minor Franklin. She's the manager of the City of Oakland's Rent Adjustment Program. She's going to answer the top questions that we received before the town hall tonight, and then be available later for the questions that come in. After Shanae, we'll hear from Daryl Dunstan, our homelessness administrator. We've gotten lots of questions about how we are helping our unsheltered brave this health crisis. After Daryl, we will hear again from Jenna Jerry, back by popular demand, the senior attorney at Legal Aid at Work, who is again our just encyclopedia for how workers can get access to benefits. After Jenna, we will hear from Alexa Jeffress, our Director of Economic and Workforce Development. And she will be giving details about an exciting new emergency grant program for our smallest businesses here in Oakland. And then finally, we are very proud to be joined by Dr. Bashara Shuker. He is the head of public health for Kaiser Permanente. He will be here to answer your health questions, and so many Oaklanders are Kaiser members. He can certainly answer questions specifically about Kaiser's health provisions right now. And then we'll be very honored to be joined around 7:20 tonight. At 7:20, our Congresswoman Barbara Lee will be phoning in to give us an update on the latest federal stimulus bills that have been passed and what specifically that means for Oakland. So let's get into my overall update. I have some slides. All right. So first of all, the big news of this week was the extension of Alameda County and the other 6 Bay Area counties shelter-in-place ordinance with a lot stronger prohibitions. This is the moment that we have got to take these admonitions most seriously. These next few weeks are the most critical if we are to flatten the curve at which this disease is advancing. And so I'm sure you all heard that the shelter-in-place order has been extended now till the beginning of May, that schools will not reconvene this school year. Schools will not reconvene this school year. And also things like construction, all unessential businesses are asked to halt. You might have also noticed that playground equipment, picnic areas, tennis courts, anything in a park that has a surface has been closed off. I know that has got to be really hard for our parents. Next slide. Again, here's just a summary of some of the new changes with this particular change, where again, things like playing a sport where the ball is shared cannot be done with anyone outside of your household. And in the unfortunate event that anyone has a funeral to attend, no more than 10 people are allowed to attend even a memorial service. Next slide. Next slide. The slide that I'm showing for those of you who are on the phone is a slide that was shared by the state of California yesterday. And it shows it's almost like a wall of what would have happened with the spread of this disease if we had not put the shelter in place when we did here in the Bay Area. If we had not enacted shelter in place when we did, we would already be at our capacity for our healthcare system. What we have done is bought ourselves time. But for those of you who can see the slide, the solid line that is going up gradually, you do see that at the end of, that as we get later into the spring, we are going to potentially exceed our surge capacity. But this is why it is so important everyone stay home right now. It is buying us time to develop. It is giving us time to see who has developed immunity. There are so many things that this extra time is buying as far as saving lives and preventing suffering. So good job, Bay Area. Next slide. Another big advancement that we're excited about is our COVID-19 testing sites. I think we all know that testing is one of those very precious and limited commodities. So we are being very careful and strategic about who we are allowing to use our testing site. We were the very first city that we know of in California to offer testing immediately to our first responders, those who are responding to medical calls, 911 calls, and we were able to very early on identify 2 cases, which we were able to trace, contact, test everyone who had been in contact with those individuals, get them into early quarantine, and stop the spread of the COVID virus amongst our first responders. You may have heard stories about how, like in New York City, tremendous percentages of first responders are out of work right now and not able to take care of the community because they did not have testing like this in place. And so I really want to extend huge gratitude to Brown and Toland, who was the first company in Oakland to step up and donate their expertise as well as resources from Blue Shield and other private funders who donated through the COVID-19 Relief Fund in Oakland to make this testing possible. Now here's the big news flash for tonight.
What's the big news flash?
Somebody's not muted. Big news flash. The big news flash for tonight is that in addition to opening up the City of Oakland's testing sites to our neighboring jurisdictions and other public workers who are having to perform essential services like Caltrans workers, BART workers, Port of Oakland workers, we are going to start, effective tomorrow, expanding our testing services to other insured Oaklanders who are showing COVID-19 related symptoms and work in direct care service sectors. That means people who work in healthcare, grocery stores, food services, homeless service providers, all of our incredible shelter and outreach workers, funeral home providers, child care workers, and people that work at residential facilities or shelters for seniors, adults, or children. So if you have an organization that falls into one of those sectors and wants to enroll to allow your employees to start utilizing our testing program, you can email covid19testing@oaklandca.gov. And I know you'll put that up on the chat. Again, COVID-19 testing @oaklandca.gov. And again, huge gratitude to Brown and Toland physicians. All right, next slide. You also have heard that we have opened the second hotel. The first hotel that was leased by the state of California and is operated by Alameda County is specifically for people who have tested for COVID or have symptoms where we suspect that they do have the virus. So that hotel is getting occupied at a pretty slow rate because we have got to save spaces for when the surge happens. That's what I was told by the head of public health for Alameda County. But the second hotel, which started accepting residents today, is for people that are particularly vulnerable to COVID. That's our seniors, people with health conditions like diabetes or have immune deficiencies. Those folks will be welcomed into that second hotel, as well as to the new FEMA purchased RV trailers that are arriving in Oakland tomorrow. Next slide. Here's some numbers to make you feel good about how Oakland has been responding. The Oakland Unified School District has been serving almost 200,000 meals a week. And big shout out to supplybank.org and also the Clay Thompson Family Foundation that has also provided some feminine hygiene products and diapers at some of these school sites to pass out. Even though it is theoretically spring break, the school district is continuing its impressive meal and grab and go grocery service at the 12 sites throughout Oakland every Monday and Thursday. You do not need to be an OUSD family to take advantage of these meals. You do have to have a child under the age of 18, but these pickup spots are available Mondays and Thursdays, 8 a.m. to noon. And then I talked about the testing. Again, we've already tested 225 of our first responders. 202 test results have already come in. The average wait time is somewhere between 2 and 5 days. So far, we have only had 2 positive tests. I believe those were police officers that, again, were immediately isolated, and it is really encouraging to see that this testing has allowed us to prevent the spread of COVID in our first responders. Next slide. Just a reminder that the Oakland COVID-19 Relief Fund is at the oaklandfund.org. Please consider making a contribution. More than 200 Oaklanders have. The fund is nearly at $5 million, although we are getting it out onto the street, but that's the total that's been raised to date. And that has gone to things like, for example, Meals on Wheels. Last week, Meals on Wheels was delivering about 8,700 meals a week. This week, that was up to more than 12,000 meals for our vulnerable seniors that are getting meal delivery to their home thanks to your generous contributions to oaklandfund.org that have gone straight out to Meals on Wheels. Next slide. That's a map of the 12 sites where the free meals as well as groceries are being distributed to anyone with children under the age of 18. Again, you do not have to be an OUSD family to go to one of these sites throughout Oakland. If you don't have a visual of it, please go to the OUSD's website to see the 12 locations for grab and go meals on Mondays and Thursdays. Next slide. And yesterday was National Census Day. It's hard to think about anything besides this virus, but it's times like these that we are so keenly aware of how important federal resources are. And what determines how much money we get for critical community services is all based on our census count. So while you are sheltering at home, please go to 2020census.gov and fill out your census. This will also prevent anybody from knocking on your door to make sure that you get counted. Please count roommates, babies, anybody in your household has got to be counted. All right, that is the end of my slides. You can give me back, thank you. I just want to share a couple more, I think, signs of hope, data that at least makes me feel hopeful, aside from that graph that showed how we are flattening this curve in the Bay Area. We get a daily report from Alameda County that every day is assessing how many hospital beds we have, how many ventilators do we have. And I really want to thank everyone in the Bay Area. I'm calling you our at-home heroes. You are at-home heroes because you have heeded the call to minimize social contact, to stay home as much as possible, and to only use our healthcare system when absolutely necessary. And because of you at-home heroes, we currently have 359 beds available in our hospitals, ready for the surge that we are expecting. We have 30 ICU and 70 isolation beds available, and we have 128 ventilators available. And so every day we are watching these numbers to make sure that we are ready to accept the surge that our healthcare system fully expects that we should see in about 2 to 3 weeks. I want to end also, speaking of heroes, to just again thank our caretakers, the people who are taking care of us, whether it's those grocery store workers that are still out there every day, the people that I've talked to that are working in our homeless shelters, doing outreach in our encampments every day. You are incredible heroes. And so if you know anyone who's working in one of these sectors, please take a moment out of your day to send them a note, to say a prayer for them, to just express gratitude for the people that are working very hard in very frightening and uncertain conditions, but to make sure that all of us can get through this with as little suffering and loss of life as possible. And that is my introductory remarks. With that, I'm excited to turn it over because we had a lot of questions about the recently enacted eviction moratorium by the city of Oakland, which also had a similar, although not as strong, action from the state of California. So I'm very excited to turn this town hall over to Shanae Miner-Franklin, the Rent Adjustment Program Manager for the City of Oakland, who is going to answer some of the questions that she got ahead of time. Thank you, Shanae.
Thank you, Mayor Schaaf. Good evening. My name is Shanae Franklin Miner, and I'm the manager of the Rent Adjustment Program in the City of Oakland, Department of Housing and Community Development. Before I begin with my updates for tonight, I just wanted to share something I've been reflecting on for the last 2 weeks. And it's really the notion that we're all in this together. The rent program helps both property owners and tenants. And for my 15 years of working with this community, I've found that the best outcomes always result from people moving in a spirit of empathy and working to resolve our common goals. COVID-19 affects all of us, and the primary goal of the city is to keep people safe. This concern for public health and safety led the council last week to pass a moratorium on rent increases and eviction. It was the most protective moratorium in the state of California. It was in line with the courts that are currently closed and not accepting filings for unlawful detainers, which are eviction actions, and the sheriff, who has a moratorium on lockouts. The Oakland eviction moratorium specifically does the following. Most residential and commercial evictions are prohibited until May 31st, 2020, and this date might be extended by the council. It prohibits rent increases above 3.5%, which represents the consumer price index. A property owner cannot charge late fees for rent that is paid during not paid during a local emergency. And the moratorium creates a complete defense to an eviction action in the future for non-payment of rent that became due during the coronavirus pandemic, if that non-payment of rent was a result of a COVID-related issue. For example, the loss of a job, the tenant became sick with the virus or was unable to work because they had to care for children. These are all reasons that can be used as a defense to an eviction action for non-payment of rent. When I began this evening, I said that we're all in this together, and the questions that the rent program has received from the public the last 2 weeks reflects just that. Tenants are concerned about how will they ever be able to catch up and repay their rent when so many people are being laid off. Property owners are wondering how can they pay their mortgages, PG&E, or make repairs if tenants aren't paying their rent. And the answer is really complex. The housing department, under the direction of Shola Alatoye, is reaching out to tenant advocates and property owners to truly assess the need and figure out solutions that will meet that need. We're looking at creative options to help everyone. We'll be working with all levels of government and the private sector to find ways to bail out tenants and property owners struggling during this crisis. I want to encourage everyone to check the Rent Adjustment Program's website, for the latest updates and resources, and please call our housing counselors who are available to assist with specific questions and can be reached Monday through Friday, 9 to 5 at 510-238-3721. You'll need to leave a message because calls are returned within 24 hours, but questions also can be emailed to us at wrap@oaklandca.gov. We're here to help and really look forward to answering all of your questions. And I want to turn it back to the mayor.
All right, thank you, Shanae. I know that a lot of questions are coming in on chat. Keep them coming. It's very helpful, and we'll continue to post answers. Next up, we're going to hear from Daryl Dunstan, our homeless administrator. And after Daryl answers some of the first questions that we got ahead of time around homelessness, we are going to hear from Jenna Jerry, who is a senior attorney from Legal Aid at Work around worker benefits. Keep your questions coming. Thanks.
Thank you, Mayor, and good evening to you all. First and foremost, if there is anyone that is viewing or listening that is unsheltered, or if you know someone who is, we encourage you to contact 211. Again, if you are unsheltered or you know someone who is unsheltered, we encourage you to contact 211. Those services are still active, and we are there to provide support. And so with that said, I'm going to talk a little bit about what the city has done thus far to respond to the COVID-19 crisis. And I'd like to really frame it within 3 buckets: what we're doing on the ground, what the strategic coordination look like, and how are we planning for a potential surge. So with regard to on the ground, the city has doubled the number of encampments that receive health and hygiene services. There are over 100 portable toilets and over 100 wash stations that are currently deployed at approximately 40 encampments throughout the city. And those units are being serviced 3 times per week. We also have increased our garbage collection service to those encampments as well. We've also suspended the closure of encampments to comply not only with CDC guidelines, but also we understand that during these difficult times, we also don't want to create an undue burden on anyone who already are experiencing the difficulties of living in curbside communities. The second bucket is what are we doing in regards to strategic coordination with our county, state, and federal partners. The city remains in close communication with the county, with the state, with our federal agencies to ensure that any guidance or policy direction that's received can be implemented as quickly as possible at the local level. We are working with shelter providers to ensure they have access to the protocols and the guidance released by public health officials, as well as access to cleaning supplies and other equipment deemed critical to service delivery. The shelters have been provided guidance from Alameda County's Public Health Department and the Centers for Disease Control and Prevention. And we also conducted site visits of the shelters early on to really identify their specific needs and to identify how we could augment services as needed. We are also monitoring occupancy levels on a daily basis to see if there are any trends that speak to things that need to be addressed quickly. The third bucket is planning for a potential surge. And so in anticipation of the need to isolate or quarantine large swaths of our unsheltered population who may be adversely impacted by COVID-19, we're working very closely with our county partners to identify and secure sites that can be used to provide just that isolation and quarantine spaces for either people who have tested positive for COVID-19, who have been exposed to COVID-19, or who just fall within a vulnerable population, meaning that they are over the age of 65 or due to their previous medical history that they're at a higher risk or more susceptible to contracting the virus. And so with that said, I am going to address 3 of the top questions that I received with regard to homelessness. And the first one asks, it says, what is being done with the homeless encampments and why can't they be closed? And so before I answer that question, I want to highlight something that my colleague Shanae said. We are all in this together, and our unhoused residents are experiencing many of the same stressors that our housed residents are. And I would say it's even more amplified because they are really just trying to survive. And so I would caution us all to use language that may be offensive. We're all here to help. We're all here to support each other. And with that said, we are following the CDC guidelines of not closing encampments, not doing huge clean and clears that require folks to be displaced, because we also understand that that may spread the virus. And so we are encouraging people to stay where they are. Our outreach teams continue to engage folks to identify what their needs are. We continue to provide food delivery services, again, garbage collection services, and really we're doing as much as we can to let our unhoused residents know that they are not forgotten and that they very much matter, and we are here to support their needs. Another top question that was asked is, how is Oakland providing shelter for our homeless and access to COVID testing? And so, as I stated before, we're working closely with our county partners to be able to expand our shelter capacity, especially in preparation of a potential surge. And so with regard to testing, there are two organizations, service contractors with the City of Oakland, Roots Clinic and Lifelong Medical, who are providing testing. But I would say that testing is being reserved for folks who are symptomatic, who have a fever, who are experiencing chest pains or cough. And so I would encourage them to go get an initial screening, and you can visit achch.org to get more information about testing and referral. And if you have any questions specifically with regard to testing and referrals, then you can send an email to covidhousing@acgov.org. And then one of the last questions that I'm going to address at this time was, is there any information on how unsheltered seniors can get access to the hotels during the pandemic? So as the mayor mentioned in her opening remarks, one of the hotels is being designated specifically for unsheltered individuals who are at higher risk of contracting the virus due to their age or their previous medical history. And so that would include seniors. And again, there is a protocol that the county is asking us to follow. Those spaces are being filled on a referral basis. And again, I will point you to achch.org /isolation housing for more information about how to be referred to the hotels. And again, you can send any questions related to COVID-19 and housing options and isolation options to covidhousing@acgov.org. And so with that said, Mayor, I'm going to turn it back over to you.
Great. Thank you so much, Daryl. I know that there is a lot of concern for our unsheltered residents, particularly during this time. So next up, we're going to hear from Jenna Jerry with answers to questions about worker benefits. This is changing all the time, but I will say that we're seeing unprecedented benefit levels as well as kind of ease, barriers removed. And then after Jenna, we are going to hear from Alexa Jeffress about small business support and workforce. So please, Jenna, take it away.
Thanks so much for having me back. As the mayor said, I'm a senior staff attorney at Legal Aid at Work, and we're a San Francisco-based nonprofit that assists low-income working families across California. We offer free legal advice and several Know Your Rights materials online at our website, which is www.legaladdatwork.org. So if you have a question that's not answered during this town hall or you miss anything I say, I really encourage you to go to our website. Specifically, the site has a page dedicated to answers to frequently asked questions about the coronavirus, which currently is available in English, Spanish, and Chinese. Additionally, our organization does offer free individual legal advice through our virtual clinics and helpline. So you can call our Work and Family helpline at 1-800-880-8047. You simply leave a message and someone will call you back as soon as we can to do a full intake. So before I dive into the questions that have come in, I wanted to give a brief overview of the various California programs and laws that may be able to help you during this time, particularly the new federal programs under the Family First Coronavirus Response Act and the CARES Act, both of which have been enacted or signed since I was last here. But as a reminder, if you miss any of this, please go to our website. Also, just to set the context, as the mayor said, we are in unprecedented times of benefits applications to the Employment Development Department. So the governor just announced today that since March 12th, 1.9 million workers have applied for unemployment insurance in California. And according to new data from the EDD, a total of 878,727 claims were processed during the week, during the end of last week. And that's a 370% increase over the claims they were processing the week before. So these are unprecedented times, and there still is a lot in flux. So I will provide you with the most up-to-date information I have, but I want everyone to be aware that many things are still unknown, and we continue to wait for guidance from our state and federal agencies. And I know, and I'm going to get to this, there's a lot of frustration with the getting through to the EDD and being able to actually submit applications for unemployment insurance. I'm going to address that a little bit later, but just be aware that I know that this is frustrating, but they are trying to do as much as they can. They've already reallocated 450 other state employees to try to process unemployment insurance claims, and we hope that there will be a faster time in the future. So I'm just going to go through the biggest state programs that workers should be aware of, and in particular, the important changes to these programs that have just taken effect. So the first is paid sick days. I just want everyone to be aware that under California and local Oakland law, every employee is entitled to paid sick days if you or a family member is sick or needs preventative care relating to COVID-19, including when public authorities recommend quarantine or self-isolation. You can use your accrued paid sick leave. So under California law, you get at least 3 days. Under Oakland law, if you work for a small employer, you get 5 days. If you work for an employer with more than 10 employees, you're going to get 9. And then starting yesterday, the federal Families First Coronavirus Response Act took effect. And so now under federal law, as long as your employer has fewer than 500 employees, you are entitled to up to 80 hours or 10 days of additional paid sick days, which are paid directly by your employer if you need to take time off work to care for yourself or a family member related to COVID-19. However, because this is provided by your employer, if your employer shut down prior to April 1st or is currently shut down and has no available work for you, then unfortunately these paid sick days are not available to you. They're only available for individuals who are currently employed and could work, but for reasons related to COVID-19, including that you've been told to self-isolate, quarantine, or seeking medical attention because of COVID-19 related symptoms, or if you're caring for a family member based on these same reasons. You can also use these emergency paid sick days if you cannot work due to caring for a child whose school or place of care has been closed down. If you're using the paid sick days to care for yourself, you'll receive your full pay up to $511 per day. If you're using them to care for a family member or to care for a child whose school or childcare is slowed down, you'll only receive 2/3 of your pay up to $200 per day. So next, I just want to give a brief overview of unemployment insurance, which really is the biggest one people are accessing right now. So overall, you're able to get unemployment insurance if you are out of work or underemployed through no fault of your own, you have enough past wages to qualify, and you are able, available, and willing to work. But a lot of this is currently changing. So generally, regular unemployment insurance benefits range from $50 to $450 per week, and you can receive the benefits for up to 26 weeks. However, the Federal CARES Act that was just signed last Friday introduces 3 big changes to the unemployment insurance program. So first, there is an increase of weekly benefits by an additional $600 per week. This means anyone receiving unemployment insurance will be getting an additional $600 on top of whatever the UI benefit amount is. And this is going to be retroactive to March 27th, the day that the that the CARES Act was signed. However, the EDD just put out guidance today that is working on the programming needed to implement this extra $600 per week, which is paid by the federal government. And this programming can't be finalized until states receive the details and final guidance from the U.S. Department of Labor, which still has not come out. So, but they have noted that barring any big surprises in that guidance when it arrives, the EDD hopes that this extra benefit payment of $600 can begin next week and continue thereafter as biweekly payments. These extra $600 payments will run through July 31st of 2020. The CARES Act also allows for an additional 13 weeks of benefits, totaling 39 weeks. So if you've already exhausted your UI benefits, you are now eligible for these additional 13 weeks, and you should apply with the EDD. Or if you're just starting your unemployment insurance benefits, you will be entitled to these 39 weeks going forward. And finally, I think the big new program that everyone's been hearing about is the Pandemic Unemployment Assistance Program, which is a new program that provides unemployment insurance benefits for independent contractors, those who are self-employed, and any other workers who do not generally qualify for state unemployment insurance benefits. So again, the EDD is working quickly with the California Department of Technology to develop the application needed to stand up this program to serve this group of unemployed Californians who don't usually qualify for regular UI benefits. It is the EDD's hope that this new program will closely mirror their prior disaster unemployment assistance program that Californians have received in the wake of recent disasters, including the large wildfires. So right now, if you truly are an independent contractor and you don't believe you've been misclassified, which I'll talk about more later, the application is still not available. And I just urge you to keep watching for updates on EDD's website that will include instructions for workers who may have already applied for benefits and were not found eligible for the regular state ones, and how they can then receive these new PUA benefits. Also, I want everyone to know that while you may not be able to file right now, benefits are going to be retroactive to January 27th. So it might take a while to get your benefits, but you will be able to backdate claims to January 27th. And just a reminder that unemployment insurance benefits are only if you have employment authorization or a permanent resident. So if you're entirely undocumented and have no pending immigration petitions, you cannot get unemployment insurance. And then just quickly, I want people to be aware of that in California, we also have state disability insurance and paid family leave programs, which allow employees who paid into the state disability insurance program to receive 60 or 70% of their normal pay, depending on income, if they're unable to work because they have been exposed to COVID-19 or because they're caring for a family member who has been exposed or needs to quarantine because of COVID-19. And unlike unemployment insurance, citizenship and immigration status do not affect eligibility for state disability insurance and paid family leave. So if you have been getting paid on a paycheck and paying into the fund, you qualify. State disability insurance and paid family leave and unemployment insurance are all administered through the EDD. And I really encourage, if you can, to apply online. Just finally, so you guys know, another part of the Families First Coronavirus Response Act went into effect yesterday. And this is extended job protected paid leave to care for a child whose school or childcare is closed. So if your employer has fewer than 500 employees and you're still working, your employer is required to provide you with 12 weeks of job protected paid leave at 2/3 your normal pay rate for up to $200 per day.
Next, we are going to hear from Alexa Jeffress, and after her, she's going to be talking about help for small businesses. After her, we also are going to be hearing from our health expert, Dr. Bashara Shukar from Kaiser Permanente. But first to Alexa. Thank you.
Yeah, thank you, Mayor, and good evening, everyone. Alexa Jeffress with Economic and Workforce Development Department. So tonight, I just wanted to share some resources that the city is put together to support our small businesses and workers during this crisis. The city's posted a survey for businesses on our website to gather data about the impacts of COVID-19, and we've heard from nearly 1,000 businesses in Oakland. So just the data that we've gotten back already just indicates that this is really a devastating impact on Oakland's small business community and on businesses and workers in Oakland. So as Jenna just said, resources are changing very quickly, and city staff are updating our website daily. Again, the website is oaklandbusinesscenter.com to keep that as an up-to-date resource for all the local, state, and federal information for businesses and workers. So I'm going to share some of these recent updates and key resources, and then I'll address just a few of the main questions we've been receiving. So as the mayor mentioned previously, and I've seen it come up in the chat before we shut it down, this week the city launched the Oakland Small Business Emergency Grant Program. We know our small businesses have been devastated in recent weeks. So with this fund, we're getting grants of $5,000 out into our community quickly to some of our most vulnerable small businesses. These grants are intended to help with basic operating costs like rent, worker payroll, and vendor payments. Grants are for very low-income business owners only, and please know that funds are very limited. To apply, you can visit the website of our partner, Working Solutions, at workingsolutions.org/Oakland-grants, and these applications are available in English, Spanish, Chinese, and Vietnamese. And as I speak through my presentation, I'm going to mention a lot of websites. I want to just emphasize that I know the information's coming quickly. If you don't catch all these websites, we can, everything is posted. Every website I mentioned tonight is posted and linked to from the city's business support website, which is oaklandbusinesscenter.com. So another form of financial assistance that's available to small businesses is the SBA disaster loan, also called an economic injury disaster loan. This is a newly streamlined version of the former disaster loan product, and an important feature of this loan is that it comes with a $10,000 cash advance grant, which can be sent to your bank account in 3 days. So this loan can be up to $2 million at a 3.75% interest rate with long-term repayment, or a 2.75% rate for nonprofits, and it carries no fees or prepayment penalties. So the online application is available now at the SBA's website, which is covid19relief.sba.gov. Again, that's also linked to from the city's business support website. Another new program that recently came out through the Federal CARES Act that was approved last week, as Jenna mentioned, is the Paycheck Protection Program. You might also hear it referred to as PPP. So this is a second SBA loan program, and it will be implemented in partnership with banks. We expect applications to open as soon as tomorrow, which is Friday, April 3rd. So the Paycheck Protection Loan is a larger forgivable loan of up to $10 million, and it's meant to motivate businesses to keep employees on payroll. 75% of the loan must be used for payroll, and the SBA will forgive the portion of the loan proceeds that are used to cover the first 8 weeks of payroll and certain expenses. A sample application is available on the SBA website, and again, linked to from our site, oaklandbusinesscenter.com. And I saw a question that came up in the chat from a faith organization asking if these SBA loans would be available to faith organizations. The Paycheck Protection Loan is available to 501c3 nonprofits and certain other types of entities with no more than 500 employees. So it seems that churches and related entities could be eligible. So again, we encourage folks to visit SBA's website and apply. I also wanted to note that sole proprietors and people who are self-employed are eligible for both these SBA loans, and they're also eligible for the disaster unemployment benefits that Jenna mentioned through the state. So we recognize that this crisis requires a variety of different financial resources targeted to different business types, and that SBA loans might not be right for everyone. So there's other forms of financial assistance that are available to Oakland businesses from partners like Kiva.org, which has crowdsourced loans that they've increased up to $15,000 in response to the crisis, as well as organizations like Main Street Launch, Working Solutions, and Pacific Community Ventures, among others. There are also a number of organizations that are offering grants and financial assistance for Oakland artists and nonprofit arts organizations. I've seen some questions in the chat about what support's available for nonprofits and artists. So we have a link to those on our website as well. At the state level, today, Governor Newsom announced earlier a series of actions to help California's small businesses, including, importantly, the free deferral of sales tax up to $50,000 for certain eligible small businesses. So this allows these businesses to defer their payment of sales and use tax for up to 1 year without incurring any fines or penalties. This information is available on the state's website, which is easy to remember. It's covid19.ca.gov. So those are some of the key resources, and Cheney already discussed the eviction moratorium emergency ordinance that Oakland City Council passed last week. In addition to protecting residential tenants, I wanted to emphasize that the eviction moratorium also protects commercial tenants, small businesses, and nonprofits that are unable to pay rent during the emergency due to COVID-19. And that eviction protection extends through May 31st. It's important to note that nothing in the ordinance relieves tenants of their obligation to pay rent, which I know there's been a lot of questions about as well. So information about the eviction moratorium, including an email that you can use, commercial tenants can use to contact the city if they have questions about the commercial eviction moratorium and how it applies to them, is on our website as well. That's oaklandbusinesscenter.com. Finally, as the mayor shared at the beginning of our presentation, Alameda County has issued an updated shelter-in-place order that's in effect through May 3rd. And this shelter-in-place order includes some important new requirements for businesses. One of the key requirements is that before Friday, April 3rd, which is tomorrow, all essential businesses that are continuing to operate in the county must post and implement a social distancing protocol using the template that's attached to the order. So the county provided a template that businesses can use to complete and post. And we have a link to the county order and a copy of that template available on our website. And again, that website is oaklandbusinesscenter.com. So next, I just wanted to answer a few of the top questions that we've been receiving, and then I'll hand it back to the mayor. So the first is, we've gotten a number of questions about property taxes, and I can see a number of those questions coming in through the chat and live as we're talking to. And people want to know what relief is going to be available if you are not able to pay your property taxes by the April 10th deadline. So the Alameda County tax collector just this week indicated that it will be waiving late payment fees on a case-by-case basis for people who are not able to meet their property tax deadline due to COVID-19. So beginning after the property tax delinquent date, which is April 10th, the Alameda County Assessor's Office will make available a penalty cancellation form specifically related to the COVID-19 crisis. So we have that form's not available yet. It'll be available after April 10th. But we have a link to that press release from the Alameda County Treasurer on our website. Another question we've heard a lot about is from many of the businesses, particularly restaurants that are still in operation as an essential service providing for pickup or delivery. We've heard from a lot of these businesses wanting to know what resources are available to them. And we've also heard from a lot of Oaklanders who want to know how to support these businesses. So these businesses can email their information to the Oakland Chamber. The Oakland Chamber of Commerce is maintaining a list on their website at oaklandchamber.com called Oakland's Open. And this is a crowdsourced list of organizations that are open during the COVID-19 crisis. So you can go to their website. Again, it's oaklandchamber.com, either to submit information about your business if you're open, or to get more information and see the list of businesses that are open and providing services during the shelter-in-place order. To make it easier for these businesses to allow customer pickup and delivery during the COVID-19 period, these businesses can contact the city at Oak 311 to request a temporary white curb in front of their business. And many of the food delivery services have waived sign-up fees for new restaurants, so making these online delivery services more accessible. And finally, for restaurants with an existing alcohol license, the state's alcoholic beverage control has eased alcohol delivery restrictions for restaurants, but only if they're combined with food orders. So the last question that we've seen from a lot of sources is people want to know what is available to assist immigrant populations that may not be eligible for these types of federal or state assistance programs I just mentioned. So Centro Legal de la Raza has a number of resources on their website. That's centrolegal.org/en/COVID-19. These resources are listed in both English and Spanish, and they include immigration-related eligibility requirements for benefits under the new federal laws, and a list of relief funds that are available for undocumented workers. So we've also linked to the Centro Legal de la Raza website on oaklandbusinesscenter.com. So again, I encourage everyone, we're maintaining our website, we're keeping it up to date. As I said at the beginning, these resources are changing quickly, and city staff are working to both keep up to date with all the latest information that's coming from the state and the federal level, and make sure that information is indexed and available to businesses, and also push out new support resources for small businesses in Oakland. So thank you very much. I'll hand it back to the mayor.
All right, thank you, Alexa. Next, we are going to hear from Dr. Bashara Shukair. He is an amazing man that I just have loved working with at Kaiser Permanente, who really kind of brings the concept of total health, public health to Kaiser's practice. So Dr. Shukair, I know you're on, and after Dr. Shukair, we should be joined by our Congresswoman, Barbara Lee. But for right now, to Dr. Shukair.
All right, thank you so much, Mayor, for inviting me to join this, this town hall meeting. I'm honored to be here, and let me start by saying a big, big thank you to folks who are day in and day out going and being on the front line. I want to give a big shout out to our nurses, our doctors, our lab technician, our respiratory therapists, our vocational nurses, our medical assistants, and everyone who's going every day to make sure that our members and patients across our footprint are getting the care that they need. And I want to also say a big thank you to all of you who are staying at home and really respecting the shelter-in-place orders to really allow us to flatten that curve. I want to just start briefly by sharing with you that we know by now globally we have more than 1 million confirmed cases of COVID-19. Here in the United States, we almost have 250,000. We're the country with the largest number of cases, and we really need to continue to double down on our social distancing efforts. I have to tell you and share the good information that we're learning that social distancing appears to be working here in California, and yet we're far from being out of the woods. So I want to encourage us to continue to stick with our social distancing practices. The good news is that COVID-19 spread in California is on a slower upswing compared to the rest of the nation. So that's really important. I wanted to share a little bit from Kaiser Permanente perspective. What is it that we're doing to support the social distancing? And we've put in place a series of strategies to help us support social distancing in our community. And you might have heard we're doing a lot of visits, and we're stepping up our telehealth strategy. And that's really important. So actually almost 70% of our outpatient care is now being provided through video or telephone visits. And that's really important. We're also on our pharmacy mail orders. We've seen almost doubling of our pharmacy mail orders at this point. And when we do these strategies, when we have telephone visits, video visits, when instead of when you need to pick up your medicine, instead of coming into the clinic, coming into the hospital, to the pharmacy, you can get it mailed to your home. We significantly reduce the number of people in our medical centers and medical offices, which is a key strategy, key mitigation strategy to help us with social distancing. And at the same time, we're still delivering excellent care for our members. And the good news is that we're starting to see some signs that this work is actually paying off. You know, the number of calls that we're getting from our members related to colds, cough, and flu, and those are leading indicator for future hospitalization. We're seeing those numbers dropping about 40% week over week in the last 2 weeks. So this is really a good sign. I also, at the same time, I want to share with everybody that we're taking surge planning really seriously. So we want to make sure that we're ready when we see a significant increase in numbers of members or patients in Northern California who are going to need more services, who are going to need to come into the hospital, might need ICU. And so we've been really focusing on what we call the surge planning. And in many ways, as an organization, we've been preparing for COVID-19 through many of the challenges that we faced over the last few years. I think many of you would remember the fires in 2017 and 2019, the power outages. So we do have systems in place and protocols to help us to respond to emergency situations. And what we're seeing today is an emergency situation. So we think about surging for space. How do we make sure we have more beds capacity so we can admit more patients if need be? How are we making sure that we're paying a close eye on our equipment so we have the right type of equipment at the right time and we're using protective equipments very carefully? We also pay attention to staff and physicians, how we're allocating their time and their location. So I'm really excited about our surge planning work so that we're there when when the uptick in number of patients will be needed, we'll be there to support our members. And then finally, before I'll go to some of the questions that we've been getting, I want to point out a little bit about testing. And as a country, it's taking us a while to get to the point where we're testing with the right amount of tests in the right communities at the right time. So we're seeing an uptick in testing availability. And here in Northern California for Kaiser Permanente, we've performed over 20,000 tests so far. And we're continuing to partner with others, thinking about what else we can do to beef up testing capabilities. So thanks to our labor partners, we're standing up a warehouse in Berkeley where we'll be able to even step up our testing a little bit more. And talking about testing, I do want to point out that we have been prioritizing first responders in that testing as well. So those are my brief opening remarks here. I do have a few questions that I'm looking through that I'd like to take a moment to answer. The first is actually a comment, and I thought this was such an important comment. And it says, I want to thank the healthcare workers, sanitation workers, transportation workers, law enforcement, and city officials for their brave work. And I have to say, I could not agree more. I think we always think of heroes as wearing capes. I look at heroes wearing scrubs and stethoscopes. And I do want to give every healthcare worker, frontline worker who's out and about every day, they really all deserve our highest praise. And I want to remind everybody that these folks are coming to work every day, working grueling hours for all of us. We should stay at home for them. So thank you for doing that. There's another question, Mayor, I'd like to bring up. It says, seniors I talk to are afraid to get healthcare for their chronic medical condition like hypertension and cancer. Is that the right thing to do? And I do want to point out that it's really important, even though we're all thinking about this coronavirus and COVID-19, it's really important that we pay attention to our chronic medical problems, particularly if you're senior. The easiest way is to pick up the phone, talk to your doctor, talk to your nurse, Make sure that you're taking your medications the way you're prescribed. And if you need to go and see your doctor, you can't do it by a telephone visit or a video visit. You have to figure out with your doctor how to be able to make that visit happen. And it's really important to remember that the way this virus is transmitted is through droplets. So it's really people sneezing, coughing, even if people are talking so close to your face. So as long as we keep a safe distance, and those droplets don't go that far. So as long as you keep the 6 feet distance, I think we'll be okay, particularly if you're going out to do something really essential, like taking care of your diabetes or high blood pressure or cancer. So it's really important that we keep an eye on doing that. I have one more question I'd like to answer, if that's okay, Mayor, before I'll turn back over to you. There's this question is like, how are we gonna get control of this COVID-19 virus? How is it gonna end? And you know, I served as the health commissioner in the city of Chicago for 5 years. And during that tenure, I had to deal with H1N1, I had to deal with Ebola. And really what happens in a pandemic like we're seeing today, we learn from previous pandemics. And you think about what happened in 1918 with the flu pandemic, 1957, 1958 pandemic, 1967 pandemic. And so you look at these pandemics and there is a pattern of how these pandemics happen. So the first thing when there is an outbreak, you'd want to make sure that you try to contain it. So you do test people, those who are testing positive, you isolate them, and those who are at risk of being exposed to the virus, you ask them to quarantine. And there's an important difference between isolation and quarantine. You isolate people who are testing positive, and then for those who've been exposed, you ask them to quarantine for 14 days, and hopefully they won't have caught the virus and they'll be fine. And in that phase, it's important to do what we call contact tracing. So if I test positive, I go back and talk to everybody who've been exposed to me, and we want to make sure that we are testing them, quarantining them, and make sure that we contain the virus. Now, when the virus cannot be contained anymore, when you start seeing community spread, you start seeing people catching the virus, and you just simply can't do that containment effort, all the isolation, all the quarantine, that's when we go to what we call the mitigation stage. And that's where you do all these measures that we're seeing today across the country. You close schools, you close universities, you cancel events, you ask people to sit at home. You start with the seniors, with pregnant women, and then you do shelter at home for everybody like we're seeing today. And with that, that's when you put these systems in place, you hope that you're gonna slow the community spread of the virus, because you wanna do three things. You want your healthcare system to be ready for an increase in number of people, and that's what we're doing through the surge planning. You wanna gain time, so maybe there are more treatments available that are more effective, and you wanna try to get, and maybe you wanna try to get a vaccine available. So you do all this work all along so that you can flatten that curve, and at some point, and I know now it feels like we're not there yet, but we're gonna get there, at some point, the number of new cases is gonna start going down. And when that number starts going down, we really need to double down on our what we call suppression efforts. And then we're gonna need to go back to do a lot of testing, find the people who are positive, isolate them, then do contact tracing with everybody they've been exposed to, so you can eventually get them into quarantine, and if they test positive, treat them, put them in isolation. And that's really, really important to do so that we can control and suppress the virus. And we'll do all of that until we have treatments that are effective and a vaccine that's effective. And that's how we can get over the pandemic. So we still have a long way ahead. It's really important to double down at this point on our social distancing practices. So with that, Mayor, I'll go back to you.
All right, thank you. I'm going to take this opportunity to answer a few questions that came in that were kind of more generic, and our Congresswoman should be joining us in about 10 minutes. So here's some questions that we got. One is that the Asian and Chinese community are suffering with verbal and physical attacks due to xenophobia. What are the actions taken by the government? We need to protect all families, especially our seniors and children. And there's kind of a related question about how well are you communicating with the Mayan and Latinx population of East Oakland about the social distance and shelter in place? This past Sunday, I happened to be driving down International and presumably saw some evidence that the word is not getting out. So first of all, the issue about xenophobia is real. And we all can do something about that by trying to support our Asian businesses that are still providing essential services like grocery, like restaurant delivery. But please let us all be aware of this. This is a global pandemic. It is not, this virus does not discriminate. It clearly is getting everyone. So again, Oakland is absolutely a sanctuary city. We provide all city services without regard to citizen status. We do not ask about anyone's citizenship status, and we are very proud of the diversity in our community, and that has only been stronger through this crisis. Any support, the emergency grants, even the Kiva loans, those are available for undocumented and documented alike. Again, that does not matter for us. I also am proud to say that because the city of Oakland has an equal access policy, we actually have more translation services available to us than a lot of other cities in our area. And so I want to give great thanks to city staff who have been translating key messages about shelter in place and social distancing. And we've actually been sharing that outside of Oakland with other cities in this area. I encourage all of you to visit oaklandca.gov/resources. If you go, again, to the city's website and go to the COVID-19 information strip and look for resources, there are several informational pamphlets, there are infographics in several different languages. And we are really counting on people within the community to pass those out, to get them out and posted in laundromats if they're still open, anywhere, you know, through social media, to please help us spread the word, particularly to non-English speaking communities. The one area that we are still working with some folks at Central Legal is MOM. MOM is a language that is not written, it is verbal, and so that is one place that we are still in need of resources if anyone out there has MOM translators available. All right, another question that I got was about that the internet should be a new utility, not something offered on a for-profit basis. And I think when the Congresswoman comes on, we can talk about broadband and net neutrality. As we all are at home right now, work, education, and health depend on reliable, cheap internet for all. I do want to say that both AT&T and Comcast are offering extremely low and in some cases free access to internet connectivity. If you are an AT&T customer, you can call 1-800-288-2020. For Comcast, you can visit internetessentials.com. Again, extraordinary opportunities during this crisis for free or extremely low cost internet. The Comcast phone number is 855-846-8376. And just yesterday, Google announced that they will be providing 100,000 free hotspot connections for students so that they can engage in distance learning. As the announcement yesterday came out that the school year will essentially be closed as far as students coming into school sites, There is a great focus now on really upping our ability to engage in distance learning, particularly for our public school students. I can tell you that some schools are doing it because I happen to have 2 public school students in my house right now. So big shout out to their teachers that are keeping instruction going. But like many things in Oakland, there is not equalness. And so this is technically spring break for our public school system. And I can assure you that administrators at OUSD are working extremely hard. And our folks at the COVID Relief Fund for Oakland are looking to raise money and try and get donated computers so we can ensure that every child in Oakland is able to continue his or her education through distance learning. That is a huge priority for us. Again, the next questions I got were questions around nonprofit educational institutions. How are we expecting Oakland school children to work, particularly if they're too young, to work independently, to be able to keep up with their studies? I just have to say that every day as this crisis unfolds, these are our new challenges, and we will be working on them. I think we are certainly going to see potentially summer school this year, and this is just all the work that is ahead of us because this crisis is still in its beginning phases. I've got another question about parks. Here's a question. So important to leave our parks and public spaces open for safe physical activity in a time of physical distancing. I could not agree with you more. And there was a push at one point amongst the big city mayors to potentially shut down all the parks. I will be honest with you, I have been a voice to say, let us not do that. Bashara Shokare, Dr. Shokare talked about how we have to keep our other aspects of our health good. And I think we all know that physical activity, exercise, being outdoors is an essential part of our mental health. And so you will see that in parks in Oakland, in fact, I went on a short walk in my neighborhood park today, Diamond Park. All the playground equipment is now taped off. Picnic areas, tennis courts. Do not touch surfaces that are in public. That's where the virus can be sitting. But you may go outdoors. We are still keeping our parks open for walking, running, and biking. And I got a suggestion also that came in during this chat, asking if we could please consider setting up a one-way walking pattern around Lake Merritt with some social distance signage. It gets a little too crowded. Thank you. So because of your suggestion, during this town hall, I texted the head of Parks and Rec, and they're going to get right on it because of your suggestion tonight. So that is real-time government at work. You suggested it. We're going to do it. You should see that up very soon because that is an excellent suggestion. And then last, there is, someone asked if we could consider banning retailers from restricting sales of toilet paper. I am not in support of that right now. Toilet paper is one of those things that people hoarded early. It is in very short supply. And I know that it's also back ordered. It is potentially available for delivery, but a lot of the delivery retailers are out of it. So please keep persevering on that. Last, I got a question, and then our Congresswoman is calling in right now, so we'll get her. 2 quick questions. Is construction prohibited? What kind of construction is allowed? Right now, nearly all construction is prohibited. That remodel that you're doing on your house, not allowed right now. The only construction that is allowed right now is securing a construction site for the fact that it's not going to be an active site, or housing or mixed use projects that have at least 10% affordable units. We know that our housing crisis is as much of a health crisis potentially as this virus. We are keeping affordable housing projects going, but as of right now, that is it. We're hoping that that might get loosened as we get through that, but that is part of the new directive. The other question I got is, Are there churches or other agencies that deliver food for seniors who can't get out and go get food or don't have any other way to get it? And that's from my dear friend, Deborah Ross. Hello, Deborah. And the answer is yes. I mentioned Meals on Wheels has greatly expanded their delivery service. There's also a group that has cropped up called Oakland at Risk. OaklandAtRisk.org is matching volunteers with seniors or others who don't feel comfortable going out to do their basic shopping. So that is another matchmaking organization, OaklandAtRisk.org. So I will say that the recording, so our Congresswoman is trying to call in, but she's getting a recording that says she is locked out by the host. So I don't know if Ivana or Justin or someone can call our Congresswoman to get her in. And while you continue to do that, I will. You got it?
No, because we lost the meeting, so let's see if we can have Justin Petra in 1 sec.
Okay. I'm texting you guys her cell phone number. Don't share that publicly. I can try and do. I have one comment asking, why haven't we seen you utilize your local media outlets to provide a message of hope and support, togetherness, or the importance of social distance? So if you have suggestions of places where I should be providing more positive messages or helpful messages, please let me know. We have started recording a daily message with important kind of useful information of the day. And then I'm happy to also do some messages of hope. I've also invited the Oakland City Council, and they're starting to provide these to us, to provide short videotapes where they are giving praise to a local hero or giving a message of hope. So other elected officials are out there just seeing beautiful acts of kindness in our community during this incredible time. And so I will continue to share those, so it's not just my voice and face you see, but all of the other great leaders that are in this with us together and are just working very hard in their districts every day to make sure that everyone is getting taken care of, and that we do take this extremely seriously, but also just remember the beauty, the resilience, the grace of Oakland. That's who we are. I know some of us are participating in the teddy bear search too. So if you haven't heard it yet, people are hiding little teddy bears in their windows. So when children are out walking in neighborhoods, it's like a game that they're playing to find teddy bears. So that's another one that is fun as well. Ivana, do you want me to keep going on questions, or do you have our Congresswoman?
Keep going on questions and we'll get her in right now.
Here's a question. What's the plan to enforce shelter in place? Seems that many are living their life business as usual. Just extending the date will not be enough. It doesn't spell it out, but typically in these times, enforcement will be more rigid too. Italy has roadblocks. New York City has $500 fines. How do we get actual enforcement of these new orders? Well, there is a complaint and enforcement email. It's COVID-19 enforcement at ac.gov.org, and I'll double check that. And maybe Justin, if you can look that up and make sure I'm getting that correct. But the county sheriff has set up an enforcement kind of email that you can email people to. And so we will go and warn people and enforce things. Another thing that a lot of people are doing to really send a message of how serious this is wearing makeshift masks. Again, N95 masks, surgical masks are on very short supply. So we're encouraging people to just use a piece of cloth or use hand-sewn masks. Just 2 precautions if you are out wearing a mask. Mostly the mask protects other people from getting your droplets. But be sure that if you're wearing a mask, that does not mean you should relax your social distancing. you still should maintain at least a 6-foot space around you. And second, be sure that wearing a mask doesn't cause you to touch your face more, because those are two things that you have got to continue to do. Don't touch your face, stay 6 feet apart from other people, even if you're wearing a mask. But many believe, I know the mayor of Los Angeles just put out a directive asking people to wear cloth covers over their mouths, not just as a way to not spread the disease, but also as a reminder that this is serious. We all have got to play our parts. Like I said, we are at-home heroes. Those of us who make this choice to stay home, this is the only vaccine we have right now to fight this virus. Staying home, staying apart, and staying hopeful. With that, any more questions, or do you want me to
I believe I unmuted Congresswoman.
Congresswoman Lee? I'm not hearing anything.
Yeah, I unmuted her, but I wonder if that's her. Let me try one more time.
Okay, I texted you her cell phone number that I have.
Right. And her chief of staff did say that she was joining, so we allowed her to join, but I don't see her in. I unmuted someone, but I don't know if she... Congresswoman Lee, can you speak?
She says, I'm on the line.
Okay, *6 to unmute, please, Congresswoman Barbara Lee. Thank you. Congresswoman Barbara Lee, can you press *6 to unmute yourself? I've unmuted you as well.
All right, I will just keep doing questions that I'm getting. One person asked why the farmer's market underneath 580 around Lakeshore is still allowed to happen. It is providing food, and in a time like this, fresh and organic fruits and vegetables are very good for our health. We really want everyone to practice social distancing, whether you're at the grocery store or the farmer's market. But farmers markets are still considered a critical service at this time. Here's a hypothetical. If we used our house of worship as a shelter for homeless people during this time, is there any support we could get from the city to help facilitate this project? I will say right now, and it just, Ivana, she says she's still putting in *6, but it says she's been muted by the host. So let's keep trying that. It is possible that churches can potentially get some funding to provide homeless services. Right now, though, we are focused on hotels. We want to try and get our unsheltered into spaces where they are separated. And in fact, Oakland is kind of lucky in that we don't have a lot of what we call congregant shelters where everybody sleeps under one roof, which is not good for social distancing. Whether it's our cabin community program or facilities like the Holland or the Henry, which are SROs, we actually have had a lot of our shelters that already have separations and separate living areas. And so that is what we're going to continue to focus on, again, with an emphasis of looking at hotels that are available for purchase, so that after the emergency is done, we might be able to keep these as permanent facilities to serve our homeless or to provide permanent affordable housing for our most vulnerable. Okay. Again, acgov.org, again, it's COVID-19. Wait, Justin, you didn't send me the whole email address, but if you want to complain about violations of the stay in place, you can also do it through the county's website, acgov.org, acgov.org. There's a question about community gardens. Would it be possible to open the community gardens with limited hours so people can take their food that's growing and not have it go to waste? Absolutely. I will pass that suggestion on to our Director of Parks and Rec. I think that's a good one. Will there be an extension to pay without penalty granted? I'm guessing that that is about property taxes. Again, the county treasurer has not granted an official extension, but what he has done is said, and on his website, if you go to the county treasurer's website, there's a form where you can apply to have any late penalties waived. Again, there's a whole cascading effect of people not having income right now. So just as rent is still owed, but you cannot be evicted for non-payment of rent, at the same time, we know that mortgage lenders are giving either a 90-day extension or holiday on mortgage payments. Bank of America's extension is going to be whatever the length of the declaration of emergency is. I made a misstatement about that last week. And I want to particularly thank Bank of America because they just donated $200,000 to Oakland's COVID-19 relief fund. So right now, there are no specific financial forgiveness programs that have been enacted for rent. Instead, we have been raising extra resources for Keep Oakland Housed. KeepOaklandHoused.org, or you can also connect with them through 211, is the partnership between the City of Oakland and several nonprofits to provide one-time financial assistance, legal representation, and other case management to keep people from losing their housing. And that is going to be very important when we come out of this. Once we get the Congresswoman on, I know that rent relief is something that the legislation is going to look at. So that is something that we will continue to look at our policymakers around. But the financial forgiveness program is difficult because you have a private contract between a tenant and their landlord, and often the government cannot interfere with that private contract. What we can do is help you meet the obligations of that contract. I got to double check on the hairstylist question because I know that that's something that I actually put in a specific request to Councilmember Nikki Bass to make sure that the eviction moratorium applied to hairstylists that are renting their chairs. I do need to double check. Alexa, do you know offhand whether or not the eviction moratorium applied to hairstylists that are renting their chairs in salons? Yes, no? You don't know. All right. We will. I'm not sure. We'll have to double check on that. I think a lot of these questions I'm looking at now were questions probably better asked by some other folks. If we don't have our Congresswoman on yet, I think it would make sense to maybe turn this back over to some of our other guests to answer some of the additional questions that have come in. Darielle, I noticed that there are a couple of questions that are specific to homelessness. And after that, I see a few more for Jenna. So maybe we'll have Darielle answer some of the questions that have come on during this live town hall. And then Jenna, you will be up next to answer some of the questions that have come in around worker benefits and employee rights. If Ivana could unmute Darielle. Thanks, Darielle.
Thank you, Mayor. So I'm going to go with the first question that I have in my queue, and it asks, why haven't you done anything about the homeless camp around St. Vincent and MLK during this pandemic? And so I want to remind all of our viewers that the Center for Disease Control and Prevention released guidance around specifically closing encampments during this public health crisis. And so I'm just going to take a moment to read what that says. The guidance says, unless individual housing units are available, do not clear encampments during community to prevent the spread of COVID-19. And the guidance is stating that clearing encampments can cause people to disperse throughout the community and break connections with service providers, which increases the potential for infectious disease spread. And our city council adopted last week this recommendation and made it law here in Oakland. And so we are abiding by that guidance, and that is why we are not closing encampments at this time. Another question is, what wraparound services are being provided for the homeless being placed in the hotel, and how many hotels are there? And so there are 2 hotels, and again, they are only accepting clients by referral only. And if you or you know someone who is interested in getting referred to the hotels, I encourage you to visit achch.org or email covidhousing@acgov.org because they are only accepting clients on a referral basis. And the wraparound services that are being provided, Abode Services is the service provider that is operating and managing the hotels. There is medical staff on site. They're providing janitorial services. They're providing food services. They are also providing social services. And again, if you are seeking more information about that, I would direct you to Alameda County's Department of Public Health website. There was another question about the Coast Guard staffing the hotels, and I have not heard that at all. As I said, the Abode Services are staffing the hotels, and we have not received word that the Coast Guard has been deployed to staff the hotels. And with that said, Mayor, I'm going to turn it back over to you.
Let's try, Liz, I saw Liz unmuted. Have we been able to get our Congresswoman speaking yet?
She's on the line.
Hi, can you hear me?
Yes, yay. Welcome, Congresswoman Lee. What amazing work you all have been doing for us in Washington, D.C. Please talk to Oaklanders and tell them about how what Congress has been doing is going to affect people right here in your home district, Oakland.
Well, listen, thanks so much, Mayor Chef. I was really happy to be able to listen for the last 10 minutes. And I just want to say you're doing a phenomenal job, our community groups, our nonprofits. This is a very serious moment for all of us. And we have to work together, and what affects one affects all. And so there are many, many initiatives that we put forth in the 3 bills that we passed. Not enough, but we're going to have a 4th bill, and I'll be talking to you, Libby, about Oakland's priorities for our next bill. But in this bill, you know, we provided in the first bill, it was an $8.3 billion bill. And in that bill, of course, we ensured that there was $3 billion for the development of treatments and vaccine. But we also put $2 billion in public health funding for prevention, preparedness, and response, funding for community health centers, and we put about $7 billion in for low-interest SBA loans for small businesses impacted by the pandemic. But also, it's important to remember that even though, and we're trying to still break the bottleneck on what is happening as it relates to testing kits and PPE equipment and ventilators and all, because it's outrageous that with all of the money that we're appropriating, and you know I serve on the Appropriations Committee, to see my community and communities around the country still not able to have what they need for our frontline workers who are doing a phenomenal job. And so we put into that first package free testing for anyone, regardless of background, status, or anything. And yet we can't seem to get the number of testing kits that we need. And so we're in touch with our Alameda County health officials, our community clinics, and what have you, to try to really expedite the test kits. Now, the second bill we called it the Families First Coronavirus Response Act, to affect the economic crisis that this is creating, which severely impacts the most vulnerable, the unemployed, gig workers, 1099 employee, business owners, children, seniors. And so what we put in that bill was paid leave. We strengthened unemployment benefits because now those eligible for unemployment benefits get an additional $600 a week for a couple of months. We're going to have to extend that, of course, given the trajectory of this pandemic. We also put in additional funding for food assistance programs for our children and our seniors. More free COVID-19 testing, and also additional Medicaid funding to address the impacts of the pandemic. So last week, now we passed the CARES Act, which was a $2 trillion bill that gives our workers and the economy a much-needed boost. Included in that bill was $200 billion investment in hospitals, health systems, state and local governments, to give them the resources that they desperately need. And of course, you know, the state and local stabilization fund, Mayor Shep, we unfortunately didn't win that battle, and so now it's for jurisdictions of 500,000 and more, and so none of us are happy about that. So we're going to try to change that in the next bill. And we added $260 billion increase in unemployment insurance benefits, $377 billion for the fast relief of small businesses, and made rent and mortgage and utility costs, which is very important, eligible for SBA forgiveness. Now, also, let me just mention, in terms of 501c3s and nonprofits, this is a whole new ballgame for nonprofits, because what happened was we wanted to get, I believe we put forth $4 billion for community services block grants. That's what we asked for. We only got $1 billion, and you know that money generally goes to the state, and then the state can contract with or provide grants with nonprofits. But instead, what the Senate did was put in a little over $1 billion for the community services block grants, but then made nonprofits eligible for SBA loans. And so the $10 billion in emergency assistance, disaster assistance loans for small businesses, 501c3s are also eligible for that. And so we're going to have to make sure that our phenomenal nonprofits here in Oakland, which are providing many of the badly needed services, that they get their fair share of this. It was probably about $100 billion that would go into this program. And so I hope that we can gear up with our nonprofits to make sure that they benefit from this. We also put $30 billion in emergency education funding and eliminated the income tax on student loan repayment assistance by employer. You know, we did fight hard for the cash rebates, cash benefits. We finally got them to back off of requiring seniors who receive Social Security benefits to file online to receive the $1,200. So we fought hard with Secretary Mnuchin, and just last night he reversed course. And so now seniors who receive Social Security benefits should, and we'll get the deadlines to you if people need to know about when. It should be in the next couple of weeks. Their checks should be in the mail without having to file the onerous kind of requirements that initially they were requiring. And so we're still sorting through a lot of what took place in this last bill, what we finally got. But in terms of just eviction and moratoriums on rent increases and what have you, thank God we have Congresswoman Maxine Waters as chair of the Financial Services Committee, because we were able to put some pretty decent provisions in for those who live in public housing in terms of trying to make sure that landlords receive the type of rent to help stabilize the housing market, but also to keep people from being evicted from public housing. But we're going to have to do more in this next bill. So thank you again very much for inviting me to be with you, and I hope everybody's staying healthy and following our governor, our Alameda County health officials, CDC, and of course, in many ways, I have to tune out the information that Donald Trump is providing because we have to listen to the medical experts. He was so late in delaying the federal government's response to this pandemic. I, again, serve on the Appropriations Committee, and over the last year, we fought hard to get him to stop zeroing out budgets for offices that dealt with pandemics, early warning signs, and how to prepare for a pandemic. And so his head was in the sand. We're way behind, and so it's taken a lot to just catch up and to hopefully level and get this curve to turn downward. And so in the meantime, follow your health directives and stay very close to your elected officials. Make sure you address and deal with the physical distancing. I know the mayor has been talking about our parks and being outdoors, and to please keep that social distancing and physical distancing. That's extremely important as we address this very deadly virus that we all know will get out of this, but in the meantime, every one of us has a responsibility to help us get out of it. So thank you again very much.
All right. Thank you, Congresswoman Lee. It is a great comfort to us that you are out there in Washington, D.C. with Oakland values. You know, I said that this president is his own state of emergency in the way that this has been handled. I do want to, and we have a little bit of time left, I'm going to turn it back over to Jenna Jerry for some additional questions about benefits, and then I will try and wrap up with some health-related questions that I know the answer to as well. So over to you, Jenna.
Yeah, thank you, Mayor. And unfortunately, I do have to jump off in just a minute here for another meeting I have. But just to quickly answer some questions that came in, there was a couple questions regarding whether the paid time off that I was referring to under the CARES Act, if you could take that spread over a period of time, in other words, intermittently. So the Department of Labor just came out with regulations about this, and overall, the employee and employer have to agree whether you can take it over time, and they have to agree on what length they can take that time. So if your employer will not allow you to take it intermittently, you do have to take it all in one chunk. It also depends on why you're taking the paid sick days. So if you're taking paid sick days because you yourself are diagnosed with COVID-19 or quarantining because of COVID-19, you can't take it intermittently because the whole purpose is to stop the spread. So the Department of Labor has come out with regulations saying you need to take that in one chunk of time. And once you return to work, then you can't take it further. But if you're taking it to care for family members or to care for your children because of school closures, and your employer agrees to allow you to take it over time, you can do that, and it's in effect until December 31st. And there's just, again, a lot of questions regarding gig workers and 1099. So again, we'll just repeat, I fully encourage you to currently apply for unemployment insurance if you believe in any way or form that you have been misclassified. Please go online and apply right now for unemployment insurance. If you do truly believe you're an independent contractor, please wait, and momentarily the EDD will hopefully have guidance out on how you apply for the new pandemic unemployment assistance that is going to apply to you. So thank you, Mayor Schaaf, and I will end there.
Mayor, we have two more questions that folks asked. Someone asked about empty building and a house to be open for the unsheltered, and then another person, why aren't we doing rent forgiveness? And those are the last questions we've been receiving.
And then I see a couple on health that some of which I know the answer to. So we are really focused on hotels and trailers. Someone asked a question about why not use the empty Walmart to shelter the homeless. I think you heard that the directive is we actually don't want to move encampments unless we have more healthy places to put people that allows social distancing and separation. So to put everyone into one large congregate space probably does not decrease the opportunity for the virus to spread. And that's why we're very focused on hotels, with a priority for hotels that may be available for purchase and permanent use as homeless serving facilities. And then Ivana, what was the second question?
About rent forgiveness. Why haven't we done anything about rent forgiveness?
I think I addressed that. Government cannot supersede a private contract that you have. You know, a tenant and a landlord have a contract, one to pay, one to give a service. So we legally, we can't just tell someone that they don't have to perform their side. What we are focused on is trying to provide ways to encourage people to voluntarily enter into some sort of rent reduction. And I think Shanae talked about the city of Oakland is available to actually mediate between landlords and tenants. And then we also have been raising more funds for Keep Oakland Housed. And that is a resource that can actually help people make their rent payments. But remember, property owners are getting a mortgage holiday. And so we're hoping that everyone is going to share the generosity and really respond to this moment as best they can. And then the issue of financial assistance for rent forgiveness is one that I think the federal government is going to take up. There's a question that we got about testing sites. When and where are they available? Because the more we test, the more we will survive. That is absolutely true. And one of the things that will be written about this moment in history was the failure of the federal government to really get testing up and running. While it is still a limited resource, we are using it as wisely as possible. And I know that people with healthcare coverage, I know as a Kaiser patient, if you are exhibiting symptoms, you can call your health provider and get access to testing. I think soon, I had a briefing today from the head of this area from Johns Hopkins, and what they have said that they are working on and what we should expect to see in the coming weeks is testing to start identifying antibodies, to start seeing who's actually built immunity to this virus, because that is something that's going to become relevant in the next stage of fighting this. But I am really grateful again to people that have made Oakland's 2 testing sites available, up and running, and we are again going to be opening up those sites to other people that are in the caretaking business, including folks that are providing us with our food in this moment. Here's a question. Do we know how many cases of COVID-19 are in Oakland as opposed to the total number in the county? And the answer is no, we don't. And I don't even know that. And the reason is Alameda County really wants to balance information with privacy. And because many cities are very small within Alameda County, they do not want to start breaking that down by city. The one exception is the city of Berkeley. You will get separate statistics from Berkeley because they have their own health department. But what the county health public health director has said to all the elected officials is that as of now, there's no noticeable spikes or real differences among the cities in Alameda County, the 14 cities of Alameda County. And so there's nothing that makes them feel like they need to share that information at this time. There's a question, I did text the head of oh, here we go. I did text some questions about what does Highland Hospital need? How can citizens get involved? Are cloth masks needed? I will read to you the response that I got from the head of Highland Hospital, Delvecchio Finley, phenomenal healthcare leader that we are so blessed to have here in Oakland. It says, we're not at the point of needing cloth masks yet. We can use cash donations to our foundation. Please. iPads if people have technology to help patients stay connected with family and for telemedicine. Donations of snacks for staff, especially for our housekeepers and our entry-level staff. It's very thoughtful. He said, thanks for asking. We can get many of these things, but they are more costly. So cash really helps. While we may not yet need some things, if people have other connections for donations, our foundation stands ready to help receive them. And they don't have an immediate need. They will definitely need them later. Things like respirators or things, please let us know and we can connect you directly. But please donate to Alameda Health Systems Foundation. That is a great way to make a difference in this. I think our time is coming to an end. There are a lot of, someone asked if I develop a symptom, a fever, cough, or respiratory distress, and I'm ambulatory, where do I need to be evaluated? Again, call a physician. I do not think testing is happening without a physician's referral. So that is something. Anyway, a lot of questions. I'm sorry we did not get to every single one, but please keep them coming. Please let us know how we can continue to improve these town halls. I always am surprised that we take up the full 2 hours, but we seem to do that each week. Again, we are pushing out a daily message with just short, helpful resources and information for you. We will continue to do these town halls each week. Thank you for your patience, as this is the first week we moved to Zoom. We did not do this all in one place as we've done for the last 2 weeks because of the enhanced shelter in place. So we had a little bit of an entertaining disruption there early on, and kind of some really inappropriate stuff on the chat. So we apologize for that. We will work those kinks out. And we probably on our social media platforms will be posting a survey so we can continue to get your feedback about how we can be most helpful to you in this moment. Oaklanders are incredibly resilient. We have so many heroes amongst us. So how we can celebrate and honor those who are just stepping up in this moment, as well as just stay together, heed the warnings from our health professionals, and do our part to make sure that we all stay safe and stay happy and stay healthy and stay informed and stay Oakland. So with that, I'm going to sign off for tonight. We will see you next week on Thursday. Thank you, incredible city staff, for being available during this whole time while you've been working so hard every day. My staff who has made this possible, all the incredible interns who are pulling the questions off of social media. There's a lot of beautiful, generous hands behind this town hall. Thank you, everybody, sincerely, so much. And we will continue to be in touch with you at all times, and especially next Thursday, 6 o'clock, we will do this again. Good night.